Good evening, everyone. I'm Sindhupa, acting consultant family physician, and I'll be hosting the session today. And I'm representing Sri Lanka College of Specialist Family Physicians. So I'm very happy to welcome you all for today's session on behalf of our college, Sri Lanka College of Specialist Family Physicians. And our speaker for today is Dr. Hashan Amarathunga. He's a consultant clinical nutrition physician at the Ministry of Health and also the first sports nutrition physician for Sri Lanka cricket. He holds many qualifications, including MBBS, MD in nutrition, and diplomas in sports nutrition from IOC and sports medicine from FIFA. So we are very lucky to have him to share his knowledge with us today. So let me welcome Dr. Hashan Amarathunga warmly on behalf of the college. And I also wish to thank Dr. Supunitana, my colleague, for coordinating this CME session with Dr. Hashan. And before we start, here are a few quick housekeeping rules. You should rename yourself on Zoom to match the name you want on your certificate. And a link for a form will be shared in the chat near the end of the session. And please fill it out. You need to attend for the whole session and complete the form to get your certificate, to the CPD certificate. And your certificate will be emailed to you. Because of our workload, it will take some time, 1 or 2 weeks maybe. And please keep your microphones muted during the session. But if you have any questions, just type them in the chat box and they will be answered later. But if you feel like that you want to ask the question on your own, after the session, you can ask the answers by unmuting your mics. So thank you again and enjoy the session. Thank you. Dr. Hashan?
Good evening, everyone. Thank you very much inviting me for this lecture today. So I put the topic as like this. As a family physician, why you should know about sport nutrition. So that is the question we are going to ask today. Let's see how it goes. When it comes to sport nutrition is relatively niche area for a lot of doctors. Even for nutrition graduates having trouble in fact sometimes managing sport nutrition because there are no specific guidelines at the moment for sport nutrition. Most are really developed by trial and error actually. So sport nutrition comes under sport science. So there are a lot of sub areas within sport science like biomechanics, physiology, podiatrics, sport psychology. Even there is
Excuse me, Dr. Hashan. I might have to disturb you for a moment. There are some noise disturbance. I mean, it's not clear that much. We can't hear you.
clear now?
Yes, loud and clear. Yes,
Right. Thanks. Sorry for the disturbance.
it's okay.
So I was talking about sports science. Sports science has a lot of sub areas. Uh, so there are sport biomechanics, sport physiology, podiatrics, psychology, and there is area called sport dentistry also. Out of these areas, sport nutrition is one of the main key areas. Uh, so So again, I'm coming to that question, why you should know about sport nutrition as a family physician. So as I feel, you should know about sport nutrition due to three main reasons. And there's another one. So altogether four. So first reason is it is one of the most common questions that usually we get. So let's say there are a lot of people are going to gym these days. So those people can ask, how can I improve my diet? What are the ways to improve the hydration? Do I need to take any supplements? Uh, what are the ways to reduce the belly fat? Those kind of questions are very common. And sometimes even athletes, national or international level athletes can come to your practice. So you have to have a good idea how to manage those people. So that is the first reason. And the most important reason is the second one. So you have to have a good idea when you're prescribing medication for athletes, especially national and international level athletes. You have to have an idea about the anti-doping regulations. Oh, that is the most important thing because so there are doctors who got banned or uh, delisted due to anti-doping violations. So one of the most popular cases is related to Lance Armstrong. He's a cyclist who won Tour de France over 6 times. The doctor involved with that case was banned for life, actually. And this doctor is from UK. He also banned for life due to anti-doping related violation. And another one in 2017, a Russian doctor also got banned for life due to anti-doping related violation. So these kind of to ban for life, you have to do very high-end mistake, but there can be consequences if you don't follow the anti-doping regulations when you manage athletes. So also when you are prescribing supplements for athletes, in our context, national and international level athletes, because they are the only ones undergoing uh, anti-doping testing, doping testing. So we have to have a good idea when you're prescribing, if you're prescribing supplements, you have to have a good idea how to select supplements, what are the ways to select correct supplements. Those are the three main things, the reasons why you should know about sports nutrition. And the fourth one is sometimes your child may be doing sports or your relations, friend or someone close to you may be doing sports. So then the knowledge around this area will be helpful to improve their performance. So those are the four reasons actually. So before going further, I would like to tell about bit about myself because my journey is a little bit strange. After doing the MSc in nutrition, I started doing IOC diploma in sport nutrition. I am the second Sri Lankan to do it. First one is with the under 19 national team, Australian national team. So I'm the second Sri Lankan to do it. After doing that, I was working with multiple sports. With time, I was able to join Sri Lanka cricket. When I joined Sri Lanka cricket, they had no idea what sport nutrition is and how to get the benefit of sport nutrition. This is the this is the meal they had when I joined for their lunch. But with time, we were able to improve like, little by little, but we were able to get into some good level with some time actually. But during the last 2 years, I have done over 100 sessions for mainly for cricketers to educate about sport nutrition. And during that period, we were able to get down high-end supplements, mainly the energy gel and hydration tablets. Those things we were able to establish. Now almost all national level cricketers has these products with them, uh, and we were able to test some new gadgets. Some we were able to establish, but this is a sweat patch. We were not able to proceed with that because the app is not working for the Sri Lanka, not working within Sri Lanka. So we didn't able to continue that. Out of all those things, our main goal was to educate, improve the knowledge, because when the knowledge is there, at least tend to start doing it. Problem is with the knowledge. So our main goal was to improve the knowledge actually. And also when there's a team in the country, or when we go outside, we always try to sneak peek to the other opposite team and get idea what they are doing related to sport nutrition. And also we were able to have chats and Zoom videos, Zoom conferences with almost all international cricket teams, sport nutritionists during the last 2 years. So we were able to get a lot of knowledge with that. So for the last 2 years, I was with the Sri Lanka cricket. Now actually I'm not with the Sri Lanka cricket full time. So whatever you do, how much monitoring you do, how much guides you develop, sometimes sometimes things can go wrong. So you have to maintain monitoring and improve your system. It's a long-term process. It takes some time actually. So coming back to sport nutrition, uh, actually as sport nutritionists, we looks after mainly four areas. That is diet, hydration, supplement, and body composition. Those are the four things that we basically manage. There are a few other areas, but these are the four things mainly we are managing. So to manage those four areas, we alter these four. There is macronutrients, micronutrients, liquids, and supplement. Those are the four things that we alter actually. There's only four things. So by doing proper sport nutrition practice, you can definitely improve your performance. There are enough research to prove that. And you can reduce your risk of injuries, risk of getting injuries. And you can reduce your recovery time, and especially you can stay healthy, because most of the athletes are not healthy. They have most of the athletes have some form of metabolic problem. So these are the four main benefits that we can get to follow sport nutrition properly. So I think all of you guys know who's this lady is. This is Aruna Darshan, who he's the national champion under 400 meters. So this kind of person can come to your practice at any time to manage. So let's say he's having a upper respiratory tract infection. So this kind of guy can come to your practice. So you have to know how to manage them with the knowledge of anti-doping. And most times gym going people can come to your practice, and they are the most troublesome guys. They don't want to know everything: diet, hydration, supplements, and body composition. So you have to know bit about everything to give a better management for those guys. So when you are starting managing, in the initial phase, what we are going to do is develop a day plan for them. So let's say they are having a practice session tomorrow. So let's say it start at 10 a.m. So in the first period, we are trying to develop the timing is basically the time to take their breakfast, time to take the pre-event meal, during event, post after event, uh, lunch, post mid evening dinner, and pre-sleep. So in the initial phase, we are trying to develop a day plan. So but complete sport nutrition plan is a very complex one. It takes at least 3 months to develop this kind of plan. So it's a long-term work. So there's a procedure to develop a sport nutrition plan. I will not discuss this area. So we'll move to general practical points. So first thing we are going to discuss is pre-practice or pre-game fouling. Ideally, so there's first thing we are going to discuss is main meal. So ideally, your pre-practice or pre-game meal your main meal should be taken at least 3 hours before start of the practice or game, because we have to give some time to absorb your meal. So ideally, it should be a high glycemic index carbohydrate with a lean protein, and it's ideal to be reduced minimal amount of fat and fiber. So fat and fiber will reduce the absorption rate. So ideally they should be low in a pre-event or pre-practice meal. The main problem in our country, not just in athletes, in the entire population, most people don't know how much to eat. That is the main problem in our country. So this is the amount of rice that one cup, this is the amount of rice that 1 cup contain. 1 cup of rice is equal to this much. So 95% of the athletes do not need more than 2 cups of rice for a 1 main meal. 95% of athletes do not need more than 2 cups of rice for a single main meal. 99% of population do not need more than 2 cups of rice for a main meal. So what we are trying to do is increase the frequency of eating, not the amount eat at one time. So for athletes, they should try to eat at least 8 times a week, 8 times a day actually. There are some sports, those athletes eat 12, 13 times a day. So what we are trying to do is in athletes, increase the frequency of eating, not the quantity actually. So, it is relatively easy to reduce the price amount, but when it comes to other carbohydrate containing food, it is relatively difficult to reduce the intake. For example, if you take bread, 50-gram bread, that is one slice of bread is equal to 1 cup of rice. So you can't have more than 2 cup. Ideally, you can't have more than 2 bread slices, this size slices. If you take sandwich bread, 2 slices of sandwich bread is equal to 1 cup of rice. So ideally, you can't have more than 4 for a main meal. So when it comes to string hoppers, only 4 string hoppers is equal to 1 cup of rice. So in a main meal, you can't have more than, ideally you can't have more than 8, but our people eat around 15, 20 for a meal. That is actually too much. So when it comes to roti, half of this roti is equal to 1 cup of rice, because this doesn't contain any fluid, or entire thing is carb. So in a small quantity, it contains large amount of energy and carbohydrate. So most of the athletes eats oats, but oats also contain relatively high amount of carbohydrate because it doesn't, again, like roti, it doesn't contain any fluid. Half cup of oats is equal to 1 cup of rice. So when it comes to carbohydrate, reducing the carbohydrate intake is relatively difficult actually. So in the last few weeks, I was doing research kind of thing. I was able to get down a CGM, continuous glucose monitor. So I was testing foods. A few days back, I tested string hoppers. I only ate 7 string hoppers. Can you guess my sugar spike? I don't have diabetics. I had a 58 milligram spike just by eating 7 string hoppers. If I ate 15 or 20, I don't know how much it will be. So in a diabetic, this number will be significantly high. So we should have a good idea how much to eat. And so till now we talked about the main meal, pre-game main, pre-practice or pre-game main meal. Next thing we're going to talk about is the pre-game snack. So if you are going to start a practice or event, you can have a snack, carbohydrate containing high glycemic index carbohydrate snack 1 hour before. The amount depends on the intensity of the activity. So there are a lot of options. You can have fruits. Banana is a good option. Watermelon, even bread is a good option. One of the easiest things to carry is dates. So dates is most easiest option to carry. So that is one of the best option to have. In the high-end setup, we can have energy gels and sport drinks are there. But most commonly used products are like this. Dates is the most easiest thing to have actually. So as you all know, the main energy source for muscle is carbohydrate. It's not protein. So carbohydrate is stored in muscle as glycogen. When you have high glycogen store, you can stay without getting fatigue for a long time. If it is low, you will get fatigue very quickly. So carbohydrate is the main factor that decide performance actually. And this graph shows when the intensity of the activities goes up, carbohydrate is the main energy source body use. When you do very high intensity activities, carbohydrate is the only source actually. So in our country we don't have method to assess the body energy expenditure, but there's a small video. She has measured that. See, uh, I think you can. So if you are planning to reduce weight, that means you are planning to reduce fat. So you need to do a moderate intensity activities. There's no point doing high intensity activities. So third thing that we are going to talk is during practice, during game, snack. So actually, if the event lasts more than 1 hour, every hour you need to have a snack, carbohydrate containing snack. And again, the amount depend on the intensity. When the intensity goes up, you need to take higher amount of carbohydrate because when you do physical activity, your glycogen storage will go down. You have to replenish that. So again, carbohydrate containing any food is okay. Date is a good practical option actually. So the endurance athletes utilize very high amount of carbohydrate during practices, during events. When it comes to this guy, this cyclist has used during the bicycle event, he has taken 104 grams of carbohydrate per hour. 104 grams. That means over 3 cups of rice every hour he has taken. So in this kind of scenario, we can't use solid foods. So that is where gels and drinks matter. So energy gels are now available quite commonly in the country. Uh, the main ingredients of energy gel is maltodextrin. So it is the most rapidly absorbing carbohydrate, glucose carbohydrate source. So this kind of product will absorb around 5-10 minutes. But if you eat banana, it will take about 30 minutes at least. So when it comes to post-practice snack, uh, that is why you need protein. Up until now, I haven't talked about protein. Now, this is the best time to have protein because this is the best time. This is the time that muscle build up is happening more rapidly. So ideally, post-practice snack should be carbohydrate plus protein containing snack. So ideal food would be something like chicken wrap, egg wrap, egg sandwich, something like that. Even if you can have a main meal right after finishing your practice, it is also okay. Uh, this kind of food like kadala cowpea is also okay because it contains both carb and fat, carb and protein. If there's nothing to eat, at least having a milk packet will be benefited rather than eating nothing. So you should have something right after finishing your practice. So protein requirement depend on person to person. In general population, general requirement is about 0.1 to 1 gram per kilogram per day. But when it comes to athlete, this can go up to 1.7 gram per kilogram per day. In bodybuilder, this can go up to 2.3 gram per kilogram per day. In teenagers, with the growth, it can go up to 2 grams. So when you know the weight of the athlete or the person, you can have a good idea about the protein requirement. Ideally, you need to take the requirement in 4-5 meals. There's no point taking the entire requirement in 1-2 meals, because protein absorption, when you eat large amount of protein, excess amount will go out from your urine. It won't store within the body. But when you eat large amount of fat or carbohydrate, it will store within the body, but not protein will not do that. So you can easily get an idea how much protein you need by when you know the weight of the athlete or your weight. So then the second thing, if you know if you know the contain of food, containing of protein in each food, then you can easily get an idea whether the requirement is covered or not. When it comes to fish and meat, 30 grams, that means matchbox size piece contain about 7 grams of protein. So if your requirement is 20 grams for meal, that means you need about three matchbox size pieces. Usually the requirement is between 15 to 30 grams protein requirement per meal. When it comes to egg, one egg contains around 6-7 grams of protein. Ranila ata means kadala kaupi mungata. Even dal comes here. 3 tablespoons contain 7 grams. Dry fish and spread contain 1 tablespoon contain 7 grams. That means 15 grams of dry fish soy spread contains 7 grams. Soya 2 tablespoons of soya contain 7 grams. 200 ml of milk contain 8 grams. So when you know, you can easily calculate the requirement. If you know the body weight, then you have a rough idea about the protein content of each food. You can calculate, you can get idea whether you are covering the requirement or not. So lean meat is the ideal to have protein, because it doesn't contain that much of fat. So chicken, fish, seafood, and egg are lean meat. When it comes to red meat, that means beef, mutton, pork, it contains relatively high amount of fat. When you have high amount of fat in a meal, the absorption rate goes down. So when it comes to beef, it takes over 3-4 hours to absorb. Pork take 4-5 hours. So this kind of food, there's no point taking during an event or even before event. So it will remain in the gut. It will actually reduce the performance. So you need to find the foods that absorb much faster. So when it comes to chicken, it takes only around 1 to 2 hours. Fish take less than 1 hour actually. So when it comes to processed meat, uh, as athletes, they tend to eat large amount of protein compared to general public, and they will eat for a longer duration until they retire. So processed meat you should not recommend at all, because that can lead to cancer and other lot of complications. When you have excess protein that will excrete via urine as uric acid, that when you have excess uric acid, it can cause gout actually. Most in the past 2 years, there were a few cases in cricket also. There are a few guys had gout due to too much protein intake. So when it comes to fat do not increase the performance. It doesn't help to improve performance. So we are trying to reduce the fat intake. So there are healthy fat, as you know, the nuts, avocado, and fish contain healthy fat, that is monounsaturated and polyunsaturated. Some oils also contain healthy fat, but most frequently products contain unhealthy fat. Chocolates, ice cream, pastries, deep fried stuff, pizza. So we need to reduce these kind of products. So especially deep fried products, because for example, if you take boiled potato, 100 grams of boiled potato contain only 76 calories. But if we make chips out of that, it will contain about 450 calories. There's a significant difference. So this this is 1 kilogram of fried chicken. It's a video actually. Uh, See how much of oil is there. So when you eat deep fried stuff, you take a lot of calories with that. So when it comes to athletes, most athletes cover their carb and protein requirement in most occasions, but problem arise with vegetables and fruit. Majority of athletes do not cover their requirement. Uh, their vegetable and fruit intake is relatively low. So when that happens, micronutrient required to almost every action within the body, that so it will definitely affect negatively to performance. So we need to highlight the requirement of vegetable and fruits in athletes. Ideally, you need to, when you're eating vegetables, ideal way to eat is you need to take several colors, because that will help to cover the entire micronutrient requirement. As I mentioned earlier, the main problem comes with amount you eat. Because most times people tend to eat larger quantity than the requirement. So in the cricketing scenario, so in cricketing context, they measure skin fold thickness. So it should be less than 70. If it's not there, they will be fined actually. So when you eat too much at one time, the body fat level will go up. So most athletes in around age of 19 and 17, they are very lean. But when they become 23, 25, most of them get fatty. So the ideal plate should be look like this during a practice day or a match day. Uh, Half of your plate should contain carbohydrate. So it should be less than 2 cups of rice if you're eating rice. And the protein amount you can easily calculate if you know the weight of the athlete. And especially on a match day, there's no point eating large amount of salad or vegetables because it will reduce the absorption rate. So you need to eat reduce amount of vegetables on a match day, basically. But on a rest day, the main thing you need to do is reduce the carb amount, because you are not utilizing carb that much compared to a practice day. Protein amount, you can take the same amount and you can increase the vegetable and fruit intake on rest days actually. So up until now, I talked about the dietary practices. Now we'll move to hydration. Actually, hydration is the easiest thing to correct and the most cost-effective one to correct, and you can get a lot of benefits by correcting the hydration. Because even losing 1% of your body weight due to sweating will reduce the performance. If you lose more than 2%, it will significantly reduce the performance. So this is data from National Cricket Squad. So when I joined in the early phase, I checked the body weight pre-practice and post-practice. So there were 6 people. I have checked multiple times. This is one day. There were 6 people with more than 2% body weight loss. So it is not that common. It is common. It is not that uncommon actually. So if you ask whether they are feeling any difference compared to any other day. Most people would say nothing. Even they will not feel thirsty. By losing 2%, you will not feel thirsty even. But it will affect your performance. Without knowing, it's affect the performance. So this is a research done in Sri Lanka. Dr. Prasanna Gamwe, who's the first new sport nutrition graduate, IOC sport nutrition graduate, is the one who did this. So what he did was he has used a national squad fast bowling squad. Divide the fast bowling squad to two, and for one squad, one team he has given adequate amount of weight, and for the other team he had given restricted amount of weight. So he have measured different parameters. This is the fast bowling speed actually, first one. So this first column is adequately drinked fast bowlers. Second one is restricted fluid intake. So there was no significant difference in number wise. There's a reduction in both, but in fluid restricted group, there is a statistically significant reduction, but when it comes to number wise, it is not that significant. Uh, the second chart shows the accuracy of the bowling accuracy. Both teams has reduced the accuracy, but fluid restricted group significantly has reduced. Significant reduction was there in the accuracy. So if you check only, you will see this. Without checking, there you will not even notice this kind of difference. So hydration matters significantly to performance, especially for the accuracy. So correcting hydration will have a significant benefit to the performance. So when it comes to hydration measurement, easiest way is to check the urine color. So if it is dark, that means you are dehydrated, but dark means it has already happened. You are dehydrated already. So this late indicator. So we need to have better option. The most practical way that we can do is measure weight, pre and post practice. Both this and this was done measuring weight actually. There are high-end ones like sweat sensors. We have tried few times, but it was not. We were not able to establish that up until now actually, because the most of the mobile apps doesn't work in Sri Lanka. These apps. So sweat contains not just water; it contains sodium and multiple other electrolytes. Sodium is the main component. So if we practice in the out outside in the daytime, if we practice 1 hour, usually you will lose about 1 liter of sweat and about 1 gram of sodium for 1 hour. But there are athletes who lose 2-3 liters of water per hour and 2-3 grams of sodium per hour. Those are the athletes we need to find early, because those are the people who get muscle cramps, muscle injuries more frequently. So hydration management will be significantly benefit in those athletes. So we need to find correct hydration source. Most times our athletes drink water only. That is not ideal at all. You need to have an electrolyte containing fluid also. In general context, if the player doesn't get cramps, you can you can ask the player to have 50% water and 50% electrolyte containing fluid during the physical activity time. So there are multiple options that contain electrolytes. We'll see. So Jeevani is the most commonly available one. But the problem is Jeevani contains relatively high amount of sodium. So as I mentioned earlier, usual sodium loss is about 1 gram per hour, 1 gram per liter actually. So but Jeevani contain about 1.7. So having Jeevani only will not cover the correct requirement actually. So when it comes to king coconut, its sodium content is relatively very low. But main electrolyte in so king coconut is potassium. So it will not cover our requirement correctly. And when it comes to sport drinks, most sport drinks contain about 600 milligrams or 800 milligrams of sodium. It will be adequate to majority of athletes, but there can be athletes who lose more electrolytes. So for every athlete, sport drink will not be the correct product. And there are electrolyte tablets also. These tablets also contain around 300 to 600 milligrams one tablet. You can have multiple tablets within the day, but that also will not cover the correct requirement. So ideally, you need to have an individualized fluid. You need to assess sweat rate, your at least sweat rate, sodium loss, magnesium, phosphate, potassium. Those losses we can assess. Ideally in international level, especially in football, uh, this level of management is happening, but not in our country at the moment. But most of the things we can do, we can cool the product. We can adding a flavor will increase the fluid intake, and cooling will increase the fluid intake. So overhydration is much worse than dehydration. So it even can kill you. So there are multiple cases of at least dying due to overhydration. So you need to have a proper idea how much the athlete need. So next part is supplements. Uh, Supplement has a benefit, but that benefit is very small. That benefit will not happen if you don't follow the basics. That means diet, hydration, body composition. So you need to focus more on these areas rather than before going to these supplements. There are multiple supplements, over 100 types. There are a lot of supplements, over 100 different variations. Out of that, the most beneficial supplement is caffeine for majority of our sports. For cricket, is football, rugby, uh, swimming, basketball, anything. Most of the sports, the most benefited supplement is caffeine. So you don't need any supplement to take caffeine. You can have a coffee. Uh, so what you need to know is when to take the coffee. So ideally, you need to take it 1 hour before we start off your game. So if you take coffee every day, the effect will go down. So ideally, you should not take caffeine every day. You should keep it only for match days. It will increase your vigilance. That means concentration. It will increase the concentration. It will reduce the feeling of the tiredness. And caffeine has a lot of benefits. You need to know when to take it mainly. And when it comes to proteins, there are different kind of proteins. Uh, so animal-based proteins are much better because it contain whole entire 20 amino acid, but uh, plant-based proteins do not contain entire all the amino acid in adequate quantities. When it comes to proteins, there are different types. There are concentrated protein, isolated one, hydrolyzed ones. So you need to identify the correct product to the each athlete. And creatine is one of the best supplements to have. It basically benefited for rapid actions like throwing events, rugby, football, those kind of events. Sport will have significant benefit. Even fast bowlers, cricketing fast bowlers will have a benefit by taking creatine. But there are methods to take creatine. So ideally, you need to load it for 5 to 7 days by taking 5 grams 4 times a day. Then you need to take a maintenance dose about 5 grams a day. And nitrate is another supplement commonly used. It actually dilate the blood vessels. So blood muscles will take will take more blood when you take nitrate. So usually, but at least take nitrate is beetroot. Beetroot juice is the most common nitrate containing product. So ideally, you need to take about 3 hours before start of the game. In 2012 Olympics, almost every athlete's urine is red because of taking beetroot. So in middle distance runners, basically, uh, they usually complain at the last part, last 50-40 meters, their muscles get tightened and difficult to run. So that may be due to lactic acid formation. So in that kind of situation, we can use bicarbonate or beta-alanine to get a benefit actually. So there are multiple other products, but they don't give significant benefit compared to those I mentioned previously. And there are medical supplements like so majority of athletes, as I mentioned before, they don't take adequate amount of vitamins, vegetables and fruits. So the best advice would be to increase the vegetable and fruit intake. But if it is not happening, you can go for a supplement, multivitamin supplement. And even in athletes, they usually practice almost 5 days a week, 5-6 days a week in the sunlight. Still, then 80% of the athletes are deficient in vitamin D. So ideally, you need to check vitamin D in almost every athlete. And if you check magnesium, almost 50% are deficient in magnesium. Uh, so ideally, you need to check blood levels before starting magnesium. Uh, and fish oil is beneficial when you have muscle pain, joint pain for a long time. Fish oil is a good product. And majority of the female athletes have low hemoglobin level. So in female, so if there's a female athlete, it is best to check hemoglobin level. Ideally, in higher levels, that means national and international level, you need to check blood levels at least annually. Problem with supplement is doping. So you have to have a good idea about doping. Doping means use of banned substance to improve in competitive sports. Use of banned substance in competitive sports. So WADA is the governing agent in this area. WADA means World Anti-Doping Agency. Sri Lanka has that branch, Sri Lanka Anti-Doping Agency. Uh, so WADA publish every year prohibited list. Book called prohibited list. It contains over 250 substances. It is very difficult to read, but in there are some common drugs that we use. For example, salbutamol is in this list, and prednisolone is in this list. Like erythropoietin is here, furosemide, and when it comes to intravenous fluids, or if you give more than 100 milliliters per within 24 hours, it comes under prohibited list. So if you give saline, it's also comes under prohibited list. You can't give more than 100 milliliters of saline within 24 hours unless within a hospital setting. So there are drugs and other components prohibited in only during in competition. That means during the competition period. And there are some products that are prohibited both in competition and out of competition. So we have to have a good idea. This is very difficult to remember. Uh, there's a app called DRO, actually, Global DRO. This is the one you need to have in your phone if you are managing athletes. Uh, so it gives a very comprehensive detail. You not only need to put the drugs name, then it will give the whether it is whether we can take it during competition or out of competition. All the details will be available when you put the drug details to here. So actually, you can confirm it gives a downloadable document. You can keep it to confirm that you have checked it. So there are instances, let's say athletes is having asthma, so they may require salbutamol. So in that case, we can take a therapeutic use exemption. It's called in short TUE. So there are instances you have to give some prohibited the drugs to athletes. So in that situation, we can take a TUE. Then there's no issue actually. So we have to be very careful when you are giving drugs. You have to be very more careful when you are giving supplements because most of the supplement in the market are contaminated with prohibited substances, even in the developed countries. So if you're an athlete, you can't go to a supplement shop and buy whatever available in the store. So there is a method to select supplements. Uh, so we had to check these badges. These are called third-party badge-tested products. Uh, there are only four actually, only four for the entire world. Inform Sport is the most common type available in our country. There's an app for that. Uh, Ideally, you should have this app in your phone if you're managing athletes and if you are prescribing athletes, if you are prescribing supplements for athletes. Without the informed sports certification and without checking the supplement through your phone, through this app, you should not recommend a supplement for athlete. So because anybody can print this in their label, but you can when you check through the app, you can confirm the product. It is a quality product as a quality product. It is come from the same the correct manufacturer. But most of the products available in the local market is even though it says USA or UK manufactured, it is usually packaged in Pakistan or India. So Inform Sport products comes from Europe market. NSF coming from US market. And Hasta is coming from Australian market. So if you are buying a product from Australian market, Hasta should be there. So these three labels, they check every batch. Every batch that comes out from the factory, they are testing. There's another label called Inform Choice. They don't check every batch. They check randomly. So ideally, you should have whatever you prescribe should have at least one of these. So when it comes to anti-doping rule violations, there are 11 anti-doping rules. So out of that 11, 4 is relevant to athletes. 4 is only relevant to athletes. Other 7 is relevant to all the support staff, athletes, and all the participants within the sporting community. So we are also coming under this. So there are another set of supplements. Those are actually prohibited to use here. In Sri Lanka, you can't use these products. In the open market, it is prohibited, but it is widely available in the gym setup. So anabolic steroid, erythropoietin, growth hormones are prohibited supplements, but they are available very low quality brands are available in the gym, most of the gyms. So taking these are very risky. So if you take anabolic steroids, it can lead to all the steroid related side effects. I think some of you guys may know him. He's a bodybuilder who won Mr. Olympiad for over 10 years. Now he has multiple spinal fractures and he barely walks now. I think he's less than 50 years. So last part, body composition. So as I mentioned earlier, fat is not improve performance. It is a negative factor for improve performance. So you need to reduce your fat amount. There are specific fat percentages for each sport. So ideally you should be less than that. When you have high fat over, when you are trying to reduce weight, most of the people try to do is try to lose weight by using a fasting method. But when it comes to athletes, fasting method is should not be recommended because when you fast, you will lose more fat, more muscle compared to non-fasting method. When you lose more muscle in athletes, they will reduce their performance, their muscle power. They will tend to get more injuries. So fasting methods are not ideal for athletes. So if your athlete are trying to reduce weight, they should eat 8 meals as usually and reduce it. When you use fasting methods to reduce weight, you will lose your weight very fast. But when you change even minor change to your diet, it will regain very fast again. So there's no point doing fasting method, especially in athletes. The best way to the gold standard method to measure body composition is DEXA. DEXA gives a very detailed report. It gives everything in grams, so we can analyze your body composition very well. So this doesn't cost much actually, around 8,000 for assess body composition. So when you are doing sports, you have to have a good goal and few steps to follow. But nutrition is comes even below step 1, it is almost step 0. So we have to do basic things very well to improve your performance and achieve your goals. So going into the highest level is relatively easy, but maintaining in that the highest level is very difficult. So we have to do a lot of things correct to maintain in that high quality standards. So diet is a very important area to you have to do it properly at each level. So I think you know him is Virat Kohli. He's the one who changed the entire physical parameters, dietary pattern of Indian cricket team. So when you follow sport nutrition, you will start to feel benefits within 2 weeks actually. So when you see the benefits, you have to follow it for a long time, then there will be more benefits. So those are the things I want to tell you. So I saw few. Right. Are there any questions?
If you have any questions, you can type their questions in the chat.
The main thing you have to know is when you are prescribing for athlete, you have to know about anti-doping related facts. Otherwise, you may get into trouble. There were some few instances in the past few years related to cricket.
Dr. Hashan, we have one question. Lots of bodybuilders inject testosterone.
Yeah,
Is it healthy?
it's never a healthy option to improve. Yeah, there are professional bodybuilders. So professional bodybuilding has two parts: natural bodybuilding and testosterone-like supplement taking bodybuilding. So there it is for that kind of bodybuilding. There are competitions for natural bodybuilding separately and for supplement taking bodybuilding separately. So it is not healthy, but bodybuilders can take testosterone to improve. Uh, it is. It is not illegal actually. For bodybuilders, professional bodybuilders only, they can take testosterone, anabolic steroid, uh, but not natural bodybuilders do not take those kind of products, but non-natural bodybuilders can take those kind of supplements, but it is not healthy actually.
There is another question. Um, can you recommend a good protein supplement we can take after workout?
For a non-athlete, you can take whatever available product in the market, but when you are considering athlete, it should contain an anti-doping certification, ideally Inform Sport or NSF HASTA. So those products are very limited in the local market. There's a product called Grenade. It contains Inform Sport. There's another one called Applied Nutrition. Those products contain Inform Sport. So those products are very good for athletes and also for the general population, because we can confirm the quality and the standard of the product by much easily. The other products, there's no way to measure the standards of quality. It may be, even though it says UK or USA manufactured, it may be packaged in somewhere near to Sri Lanka, somewhere in Pakistan or India. So ideally, if you are using a supplement, if you can use anti-doping certified product, the quality will be guaranteed.
Is it okay to use pre-workout energy drinks?
Uh, so there are pre-workouts, there are energy drinks. I think you are mentioning uh, Red Bull kind of product. Uh, so if I tell about Red Bull, Red Bull contain large amount of sugar. It's contain about 27 grams of sugar per one can, and it contain around 150 milligrams of caffeine. Uh, so the benefit of Red Bull comes from the caffeine. So apart from that, you are taking 27 grams of sugar. So if you can take caffeine instead of taking Red Bull, you will have better benefits rather than taking a Red Bull.
Someone is asking whether they can have the recording. We always upload our CME sessions to the YouTube. You can access to all the CME sessions via SLC SFP YouTube channel, Sri Lanka College of Specialist Family Physicians. Okay, the other question is, some of the supplements taken for bodybuilding end up with diabetes. What is the reason, please?
Yeah, so if you take anabolic steroid, you can end up with diabetes for sure. When it comes to bodybuilding, bodybuilders they tend to eat large amount at one time. That can lead to diabetes in the long run also.
Okay, what is the place of what is the place of table salt and glucose powders added to water commonly used by many during school events?
Yes. So I mentioned about electrolyte supplements. So manage hydration, you can use electrolyte containing fluids. So when you don't have G1E or any other fluid, you can use table salt and glucose to prepare a G1E like product. So you can use 2.5 grams of salt along with 20 grams of sugar. Then you can have a G1E like product there. So you can have something like that. When you don't have G1E or any other product, you can. This is a very cost effective way. You only need 2.5 grams of salt and 20 grams of sugar per 1 liter of fluid, 1 liter of water.
Okay, is there a benefit of taking creatine before a workout?
So taking creatine before a workout, there's no benefit. So if you are taking creatine, you have to take for a long time. You can take it at any time of the day. Ideally, you should load it for 5 to 7 days by taking 5 grams per day, 4 times a day. 5 grams 4 times a day. You need to take 5 grams 4 times a day for 7 days. Then you can take 5 grams a day. So you can take about 3 months. Then you can stop for about 3 months without loading. You can again start in about 3 months time. So there's a benefit by taking creatine, especially for athletes. But if you are just going for a workout, there's no significant benefit. If you're not performance oriented, there's no point taking creatine. You can do without taking creatine the same thing.
Okay. Methionine or dianabol, what are the side effects?
So they are anabolic steroids. So steroid side effects will be there when you take those kind of things.
What about carbohydrates loading for endurance athletes? Is it still in practice?
Yes, of course. I didn't mention about carbohydrate loading. So as I mentioned earlier, the carbohydrate is the deciding factor of your performance. So carbohydrate loading will help to increase your glycogen storage. There are multiple methods of carbohydrate loading. There are 7-day methods, 3-day methods, 1-day methods. So you can use either of those to increase your glycogen storage. When you have a higher glycogen storage, you can stay without getting fatigue for a long time. So carbohydrate loading has a place to improve performance.
It seems those are the only questions we have. So that brings us to the end of what has been a truly eye-opener and informative session. So Dr. Hashan Amarathunga, on behalf of the college, I extend our sincere gratitude for your time and for you for sharing such a comprehensive overview regarding the area you are specialized in. And to all our attendees, thank you for your participation and joining us this evening. So I hope this session has been highly beneficial for you as doctors, especially as primary care physicians, and maybe as people who are engaged in physical activities like exercises. So I think we can end today's session. So good night. Thank you.
Thank you for the invitation. Yeah.